Good morning, everyone. Happy to be here today. As Chris said, I'm Cassie Porterfield with Rubric. And if my hand is shaking, it's still kind of a candy high, not from nerves. So I'm very happy to be able to introduce our panel today to discuss our 5G network Ready Now and driving retail and healthcare transformation in Arkansas. So we have Roopi Crowley, Director of Strategic Accounts at T-Mobile for Business. Ken Bush, Senior Director of Networking and Engineering Operations at T-Mobile for Business. Dr. Christine Gall, Senior Product Manager. And then Russell Pope, Manager of Regional Networking and Engineering.
All right. Thanks for having us out today, and we're here to, as stated, to talk about the 5G network a little bit, set the stage for our panelists here to talk about retail and healthcare and how innovation's gonna drive that space. There we go. All right. I'm Ken Bush. Senior Director of Engineering and Operations for T-Mobile. This is my territory. I'm based in Overland Park, Kansas. I've led a group of engineers in charge of site design, technology deployments, network optimization, and operations. I've been in the industry for 34 years. I've been working with T-Mobile for now 24. And my colleague here, Russ Pope.
Yes, good morning. My name is Russell Pope. I'm a Senior Radio Frequency Manager for the Heartland area. I've been in the wireless industry now for just about 30 years, and I have 27 years with T-Mobile. My team, we do all the optimization and performance along with business growth and design for the Heartland, which includes the great state of Arkansas. Let me introduce our first panelist, Dr. Christine Gall. She leads the product marketing strategy for healthcare at T-Mobile, collaborating with healthcare leaders and clinicians to create telehealth and mobility solutions that address the day's most significant challenges. She believes that T-Mobile's robust 5G network is key to addressing health disparities and barriers to access that impact population health. She's been a healthcare leader for over 30 years. As a nurse, she has practiced in inpatient, outpatient, and home care settings. She has designed and implemented multiple clinical programs aimed at addressing gaps in services and care for underserved patients. And before joining T-Mobile, she consulted with local government to support their pandemic emergency response. Dr. Gall's academic credentials include a Bachelor of Science degree from the University of Wisconsin-Milwaukee, a Master's of Science degree in Healthcare Management from the Lubar School of Business, administration at the University of Wisconsin-Milwaukee, and a doctorate degree in Public Health Leadership from the University of Illinois, Chicago. Welcome, Dr. Gall.
Thank you.
All right, and I'm going to further introduce Roopi Crowley to my right here. Roopi is Managing Director of Retail, Oil and Gas at T-Mobile. She helps retailers drive in-store engagement through a personalized shopping experience, increase store productivity with effective communication and execution, improving in-store fulfillment for the customers. She was recently the former VP in Strategy plus Branding, Retail Innovation, and Global Marketing at Bed Bath & Beyond. Roopi has over 25 years of retail industry experience supporting store operations, signage, packaging, new stores and remodels, merchandising, and customer experience within marketing channels and stores. She is an advisory board member of the Customer Experience Program at Seton Hall University, Stillman School of Business. Roopi?
Thank you.
All right. Let's dive in. So, we're here to tell you just a little bit, get you grounded in the network. So T-Mobile has established itself as a 5G leader. We have our extended range 5G network that is covering over 2 million square miles across the U.S. That covers about 98% of the Americans. Our ultra capacity 5G network, as of last week, Mike Sievert announced in our earnings call that we exceeded the 300 million covered pops.
So what fuels 5G? Well, it comes down to this spectrum. How we utilize that spectrum is key. So let's start with the low band extended range. This is our foundational 5G that we have in the network. The speeds are a little slower, but we have a much larger footprint from coverage, and it easily penetrates into buildings and homes. Let's go on the other end of the spectrum with the high band or the millimeter wave. Excellent speeds for millimeter wave, however, very, very small footprint, and there is limited ability to penetrate into homes and other type of buildings. And right in the middle, we have this mid-band, this ultra capacity. It's the best of both worlds. It has this balance between the coverage and capacity. So you still get great speeds, but you still can penetrate into homes and buildings to provide that 5G coverage. So let's take a look at how do we deploy this the spectrum into the network. I'm going to use the state of Arkansas as an example, since this is where we're at this morning. And let's start at the end of the year 2021. And what you're seeing is we have our foundational 5G with extended range throughout the state of Arkansas. And we're just now starting to see that ultra capacity come into the major metropolitan areas. If we click forward to end of year 2022, you can see how we've grown that ultra capacity footprint, not just in those major metropolitan areas, but also throughout some of the rural communities throughout the state. And then finally, here in 2023, we have continued to fortify our coverage within the metropolitan areas and also get the additional ultra capacity throughout these rural communities and beyond throughout the state. So we're going to continue with this growth, not just here in 23, but 24 and beyond. It's going to provide us additional coverage, capacity, these 5G speeds that everybody wants. And also we're going to include additional reliability to the network. Please note that what you're seeing here in Arkansas is happening throughout the T-Mobile network. So this is not isolated just to Arkansas. We're doing these expansions everywhere.
All right, I'm going to talk a little bit about highway coverage and overall density of the network. So as you know, I mean, we in the U.S., we travel. So those that are road warriors, this will be important to you. You know, we have over 99% of the interstates covered, and then all highways, we're covering about 93%. And as you can see, there's a number of ways that T-Mobile is leading in the 5G space. I'll talk about a few. We've got a few first. T-Mobile, you know, was the first in the world to establish its advanced 5G standalone core network that really sets up the utilization of the network and the fuel that Russ was talking about a bit with the spectrum that we utilize and how we use it. We launched the four-way carrier aggregation, which aggregating multiple channels together gives you the bigger highways and the speeds he was referring to. And then we we have the most, T-Mobile has the most voice over new radio calls handled globally. One of the things that's really big in our space, we've just recently expanded, and we've established the first network slicing for beta to developers nationwide. And then this is gonna, these ladies here, our panelists, will talk a little bit more about how this base network's going to really fuel those spaces. I would be amiss without saying that, you know, our third-party Ookla and OpenSignal measures networks, and Ookla rates T-Mobile as overall network leader. OpenSignal has touted that T-Mobile as global leader for 5G availability. All right, we're going to switch gears a little bit, and as we introduced earlier, we've got Roopi Crowley, Managing Director of Retail Oil and Gas at T-Mobile, and then Dr. Kristen Gall, Head of Healthcare and Marketing at T-Mobile. So, there we go. All right, I can get rid of that clicker now. So, first question is going to go to both of y'all, and we'll start with you, Christine. So, retail and healthcare have undergone rapid technological transformations over the past few years. How are healthcare facilities keeping up?
Well, first of all, I want to thank you all for having us here today. I will say I've never been to this part of the country. It's gorgeous, so happy to be here. You know, as I look at what has happened to all of us the last 3.5 years with the pandemic, we are in a really challenging place in healthcare. We have not yet recovered from the pandemic, and you're probably seeing that as you access healthcare services. There are 4 major themes that have occurred and that are continuing to occur that, in my opinion, is going to change the healthcare landscape forever moving forward. And technology, including 5G connectivity, is going to be a major component of the future of healthcare delivery. The first challenge or trend that I'd like to talk about is the workforce. Forbes estimates that by 2025, 47% of healthcare workers that were employed at the beginning of the pandemic will no longer be in healthcare. There are people that are deciding to take early retirement, others that have left the industry altogether, and unfortunately, there are not enough students in the schools of medicine and nursing to replace them. So we are facing a very real workforce shortage, and as a result, we need to look at where talent is going to happen, where it's going to be supporting bedside care. What this is also meaning is the nurses and doctors that are treating patients at the bedside, their tenure is less. When I started in nursing, the average tenure of the nurses at my hospital was almost 20 years. Now the tenure of the average bedside nurse is just under 2. That knowledge drain is a major challenge, and what it's going to require is novel solutions. As an example, I'm working with some healthcare organizations that have decided to take those nurses that have said, you know, I just can't manage the stressors of bedside care, but they have this incredible expertise. Well, we're providing them with the ability to remotely mentor their colleagues at the bedside by managing them remotely through a call center and being able to guide them, for example, looking at a wound, instructing them on what they're assessing, what they're seeing, and how to best dress that wound, as an example. So that's one example of how workforce challenges are really being addressed. Next, because you might not know this, but the single largest expense for a hospital, it isn't the building, it isn't physicians, it isn't equipment, it's nurses. And as a result, When people are leaving and there are vacancies, people are also leaving to go to staffing agencies. And those staffing agencies are turning around and taking the nurses that used to be employed and bringing them back to that hospital at a double and sometimes triple the amount of money that they were being paid before. That's unsustainable. So in 2022, when financials started hitting the news, you saw the marquee organizations like Mayo and Cleveland Clinic, Kaiser Permanente, booking millions, hundreds of millions, and in some cases billions of dollars in losses. So unsustainable for certain. And another theme that's happening as a result of the pandemic, is competition. You all know that you can go to your local Walmart and access healthcare services. Best Buy has a geek squad that comes out to your home and sets up remote patient monitoring equipment. That's the future of healthcare. Healthcare is becoming increasingly mobile and requires the support of a 5G, a very reliable 5G network. Meanwhile, you have consumers who've decided to consume healthcare differently. Used to be, we very dutifully went into the hospital, waited our turn, went to see the doctor, were directed where to go from there. Now people want to access care when they want it, how they want it, and where they want it. So we are having to look at delivery systems that are increasingly mobile and meeting the needs of people where they live. And then finally, the pandemic addressed a major healthcare disparities gap, and it ripped that Band-Aid off so everybody can see that depending upon the zip code in which you live, you will have less or more, greater or lesser access to care and quality outcomes. The health disparities gap is something that T-Mobile is positioned very well to fix. In fact, when Sprint and T-Mobile merged in 2020? Yes, 3 years ago. One of the commitments we made is that by 2026, we would be reaching 99% of rural America. And as just shared, we're hitting that mark very quickly. So it's actually why I joined T-Mobile as a public health leader. I recognize that we're going to have to deliver healthcare differently, and T-Mobile is positioned very well to be a strong partner in that.
Dr. Gall, thank you for that response. Roopi, again, let's talk retail. So it's undergone rapid technological transformations over the past few years.
Yes, Ken, it has. I think if you look at what Christine said, the pandemic changed society. And in retail, nobody spent money in technology. Is a void. 10 years, maybe your IT budget was approved. So during the pandemic, they had to look at their infrastructure and rapidly deploy curbside pickup. It was at my old company, it was a 1-year project. We had to do it in 30 days. And then the companies realized that they don't have the infrastructure to execute this. So that opened up so much inside an organization that they had to look at how do we get from A to Z quickly, and bringing the disparate teams that wanted different things together to have strategy sessions. So I say 5G, like when I joined and talked to retailers, they said, it's hype. What can 5G do for me? Within 12 months, everybody changed their tone. They looked at their infrastructure, and they needed speed, low latency, higher bandwidth for the technology they needed. Why was that? As Christine stated, there's a nurse shortage now that's developing and a labor shortage. That's the same thing in retail. During the pandemic, people started to change careers, work from home. Maybe they didn't need that second income. So the workforce shrunk. Retailers had to look at their infrastructure and create the foundation. It's like your house. We want to put in a patio. My husband said we had to get an architect to look at the foundation. I said, why? The same thing in retail. They had to really take this Band-Aid off and look inside. And yes, we have cable, we have wireline access, but we don't have wireless. And so 5G became key. They needed mobile POS. They had less people, less inventory in the stores to execute, right? There was supply chain issues during the pandemic and still today. So looking at that was key to them. In addition, they started to reinvent their stores. They became distribution centers. People want things faster. We don't have time. We don't have patience to wait for our item. We're even, the free shipping, we're willing to pay $2 more today for our Uber Eats order because we want it instead of 40 minutes in 20 minutes. Or something we order online from a retailer and we'll pay the extra $2 because I need it for a recipe tonight, which I actually did last week. So I think, based on that, retailers have now said, okay, let's change our footprints. Distribution centers are very different today, and the store's back office is different. They've created this local shipping model where they're saving costs because now they're shipping from their local store to the local address versus the DC that's in 3 states away. So they needed the connectivity inside as they push out orders. People, their store associates have tablets and phones to go scan inventory and pick that order. But if they don't have connectivity, it makes it more challenging. Those are some key things that are happening, and changing the store footprint from a 50,000 square foot store to a 20,000, they definitely need more ability to house less inventory, but having that associate be able to satisfy that customer's demand with a tablet and order online. Because it's easy for us to go to our phone and order something, but why not have the store associate do that? It's all about brand loyalty today and what the customer wants. And the more technology put into a store to satisfy that customer, the more lasting success you're going to have in that retail store, and you're really future-proofing your store for the next 5 to 10 years.
Roopi, thank you. And I do notice our stores changing a lot. I'm not in retail, but I can appreciate the transformation that's going on. All right, Russ.
Yeah. Dr. Gall, you mentioned the healthcare challenges in rural areas. Can you provide some examples of how 5G can improve care to patients in these underserved areas?
Yeah, sure. In a word, telehealth is expanding how people access care. 1 in 4 people that live in rural America do not have access to the certain types of services that they particularly need. When I look at physician coverage across the country, in rural areas, there are 37% less primary care physicians than in urban areas. And that gap expands to almost a tenfold difference in specialists, in a drop in specialists in rural areas compared to urban areas. And that's specialties of all types. So you might have a specialist nearby, but they might not be in the discipline that you need, for example. So telehealth is really a way that you can, regardless of the zip code, regardless of geography, access care. Prior to the pandemic, only about 1% of people had tried telehealth in this country, but due to the factors that we've all just lived through, during the pandemic, that number increased to 38%. And I'll tell you, telehealth is nothing new. It's been around for over 3 decades, but I'll tell you, I was one of the people who kind of looked sideway glance at telehealth saying, oh, that's a lesser way to access care. But what we've all recognized is that there is a place for telehealth services, and certainly when it comes to, I have this symptom, I have this problem, and I don't know what to do with it, it should not depend on how close you live to a specialist, whether or not you're going to get a proper diagnosis, and telehealth can definitely support that, and clearly requires the 5G engine of T-Mobile to make sure that it's delivered reliably. Secondly, we have been working with organizations that are trying to deliver mobile services, including mobile CAT scans to less serviced areas. So on certain days of the week, they might be going to a region, setting up in a parking lot of a major organization, and the radiologist doesn't need to be there. Those films can be automatically delivered to the radiologist, and that requires high speed, the ability to manage large data packets and low latency so that they can read the films and immediately, within minutes, diagnose the condition, and return the result to the patient. That's happening today and will continue to extend into the future. Next, chronic disease management is another area. You know, I think many of us have wearables today. We use it, it has become part of our daily life. And there are actually data that show that those that have access to their own biometric data are really using it to manage and make lifestyle changes and choices. As an example, there was a study of patients who had hypertension, and of those that supplemented their physician visits and their medication regimen with a wearable that would tell them ongoingly what their blood pressures were, 70% of those patients who used remote patient monitoring and wearables actually got into the desired range for their blood pressure, versus only 30% of those who did not use wearables but only managed their blood pressure with traditional medication management and seeing their physician routinely. So it's really a way to leverage and give control back to people to manage their own chronic diseases. Another area that is important, I think, when it comes to the other extreme, so let's say you've been diagnosed, you need surgery. Again, you should not need to travel to the specialist in all cases. What we're seeing is people who have been recognized, who have been published for their expertise in certain surgical procedures, can remotely scrub in and advise the local team on what they're seeing. There are actually, AR, VR imagery that can be overlaid on top of a patient who's laying on that surgical table, and the remote physician can say, okay, pick up an organ and say, okay, I want you to use this approach, and discuss the procedure even before the first cut is made. That's all possible. It's not what's coming. It's technologically been demonstrated to work. Cleveland Clinic has a product that does this, and they are in various levels of testing right now. So again, that's something to look forward to. And another example I'd like to share, we're right now, T-Mobile is engaged with one of our healthcare provider colleagues out east, and we are connecting their ambulances. They have a group of neurologists that practice telemedicine between hospitals within their network. So the neurologist might be managing a patient remotely at one of their outlying hospitals, but they want to start care before that stroke patient arrives in the hospital. So we're enabling their ambulances to be able to set up a televisit so that that remote neurologist can actually assess a patient as soon as the EMS team arrives. And it's estimated that we are going to save 15 to 20 minutes on the front end to delays in treatment. And I'll tell you, with stroke, time is tissue, and every minute counts to being able to enable somebody first to survive the event and then to have a chance to fully recover. So again, all of these are incredible examples of how T-Mobile and our 5G network is going to support healthcare in the future.
Outstanding, thanks. It's nice to see that network coming to life and what it's going to do. I get real excited about that stuff.
Yeah, if you can't tell, I do too.
Yeah. All right, this question's going to go for both of y'all. Roopi, we'll start with you. All of you and myself included, I'm hearing a lot about AI, so everyone's discussing it, what's the future of AI? And really, Roopi, what are the biggest impacts we can expect from AI on retail?
So I think AI combined with machine learning, there's three critical areas. One is, customer service, which I mentioned earlier. Customer service compiled with the employee shortage, using AI for medial tasks that are critical to the retailer, such as inventory, restocking shelves. In the past, it was more go out to the floor, see if you need to fill the shelf. So imagine now, in a supermarket, you're out of Cheerios in the middle of the day, but you have about 2 pallets worth in the back. What if there was an alert, there was a shelf that could calculate that and let that store associate know you're out of Cheerios and you have 10 boxes in the back, and what if a robot could bring it out to you, right? These are the things that AI can accomplish. The other thing with customer service, I think it goes to chatbots, right? How chatbots have emerged from before to now, and some of us might not like them when we're trying to get an answer, a human on the phone or we're on a website. However, they actually have some intelligence behind them now, understanding your shopping pattern, your behaviors, so they can actually help faster. They can also understand your emotional state. So, I've seen it activated in call centers, to help understand that there's an escalation going on and then maybe their supervisor has to jump in, or somebody calls and it's a repeat customer and they might be out of something and we can suggest that. So chatbots are emerging, and it also helps with the worker shortage. The second thing I would say is demand forecasting. So real-time analytics to make sure you have items in the store at the right time. So here's an example, again, a supermarket. What if there's a storm coming, right? Where we are tracking that shipment, but it's never gonna get to the store in time because they're gonna have to go to another route because of the storm coming, and that produce is gonna be spoiled. What if we can automatically tell that truck to go somewhere else to another store and then reroute all the inventory that was coming to that store to the store that is now impacted, right? These are things that are happening in real time. And again, it goes back to technology and the 5G infrastructure, making sure your company is set up to deliver all of these changing demands. The third thing I would say is fulfillment, how we're fulfilling these orders with rapid speed. The retail landscape has changed. We have less inventory in the store. There's high theft in the US. The theft is hitting retailers' bottom line very hard. So they're selective in what they bring into the store. So understanding what the customer wants in real time is important, as well as where they're walking in the store and understanding traffic patterns. So all of that combined, it goes back to AI. AI can be scary. When we're searching the web and we talked about getting a new dining table and all of a sudden you're getting push-outs of dining tables, it can be a little overwhelming. However, if it's done properly with more behind it, with some machine learning, it can be very effective. Those are some things I've seen in retail that are emerging.
Roopi, thank you. You mentioned chatbot, and I hate them. I don't like them, but I will share that most recently I had a positive experience, and it actually solved my problem. I couldn't believe it.
With rapid speed, I'm sure.
It was. It was really fast. Didn't leave my living room. All right, so let's switch over to healthcare. Again, AI, what are the biggest impacts we can expect from AI on the healthcare industry?
Roopi said it. I think the challenge to fully integrating artificial intelligence and machine learning into workflows in healthcare are going to be dependent upon the oversight of the development of those predictive models. I was developing predictive models 25 years ago. That's nothing new. But what's new is the awareness and the adoption and the interest in AI today. And there's the further push in healthcare in particular that AI is going to assist in addressing that workforce shortage and gap that I talked about before in a couple of key areas. One is in automating workflows. When the electronic health record came upon the scene about 3 decades ago, it was touted that, it was going to revolutionize how care was going to happen. But what happened, I think unbeknownst to a lot of us, was that these technologies didn't interact, they didn't interface, they didn't connect with each other. So there were all these integrations that required some manual workarounds. And guess who was responsible for the manual workarounds? It was the staff. The highly educated, highly trained staff had to be the duct tape between all of the systems that they worked on. So we now have a workflow that really is fragmented, and it came to a head, I think, during the pandemic when you had less staff, really, really sick patients. Systems were overwhelmed when people said, I've had enough. The term I heard in one physician group was death by clicking, that, oh, you just have to click 3 more times here. And it's like, yeah, but that just interrupted what I was just thinking through. And when that 3 times multiplied times maybe 300 times in a day, that's a lot of excess activity. So AI is going to take over some of that automation, automating tasks that are manual, mundane, and don't require knowledge and expertise, so that the professionals can practice at the top of their educational level and expertise. Next, I think we're going to see the enhancement of decision support. So as data comes in and patients, providers are able to diagnose, they're going to have the benefit of those patient-related data running through algorithms that say, you know what, consider these three diagnoses and rule out this. And so giving them guidance, not that it's going to replace physicians, that cannot happen. There's always a human element to every form of medicine. But I think you're going to see this technology extending the reach of providers. I have a story to tell. And it's about somebody named Jim. He's an 86-year-old, and he's in relatively good health, but like people his age, many people his age, he suffers from a couple of chronic illnesses. Well, over the course of several weeks, his chronic illnesses caused him pain, which made him less mobile. He spent more time in his chair, less time going around his senior community where he lived, and as a result, he went to the kitchen less and he was drinking less water. Over time, he started becoming sleepier during the day, doing day sleeping. His tiredness evolved, restless at night. And then he started getting kind of forgetful. And his wife, who lived with him, just thought he was being ornery, is what she called it. And but what was really happening was he was dehydrated. And one morning, he woke up, and he wasn't just ornery, he didn't recognize his wife. So he was rushed to the emergency room. He was diagnosed with multi-organ system failure because his dehydration had led to a major electrolyte imbalance. So over the next 4 weeks, he was fighting for his life in the hospital, and then followed by 8 weeks in rehab, relearning how to feed himself, dress himself, and walk. And here's the thing, it was just water. Had somebody recognized that he was dehydrating himself and that had caused this snowball of events to happen, and here's the thing, there's technology that can do this today. There's a smart band that actually uses gesture technology that can estimate your fluid intake with a high degree of reliability and correctness that could have saved this entire episode. And you know, I'd like to know by a show of hands, can anybody relate to this story? Do you know of anybody in your life that this has happened to? It happens a lot, and it's highly preventable. And here's the thing, I'm in healthcare, and Jim's my dad, and I didn't see it coming either. So this is just another thing that I think we are going to learn how to deliver healthcare in different ways and receive healthcare in different ways, and I'm happy to be part of the team that can partner with all of you in optimizing healthcare for us all.
Awesome. Thank you, Dr. Gall. Appreciate that. Roopi, as mentioned earlier, T-Mobile has invested in building a vast network with a commitment to providing connectivity for both urban and sometimes overlooked rural communities. Do you have any stories of how T-Mobile for Business has helped rural businesses overcome connectivity challenges?
Sure. You know, in rural America, sometimes at the heart of the town is 1 or 2 retailers, and they are the core infrastructure for the community to function. So it's important for them to be able to deliver what that community needs, whether it's healthcare or food, right, or a place to shop for other essentials. So, you know, one of our clients is Tractor Supply, and they are definitely in the heart of rural America with thousands of locations. So while they, have any of you been to a Tractor Supply store? They don't just sell tractors. I found that out one time when I went in. So it's like, they sell a lot of different things, and the community counts on them. They have pet services. There's, like, I walked in once, I heard the story by them. I did see dogs getting shots and things, but there was a llama getting a wash. They have things like that. But, the critical thing I will say with them was, during the pandemic, they opened up, their parking lots to give back to the community with wireless technology. They also had DSL in the store, and it's not reliable, as they were opening up more and more stores to get cable into locations with thousands and sometimes $1 million. So they leaned on, what else can we do to fix our problems and open up new stores on time. They, started to work with T-Mobile, where we could deliver 5G as their primary into the store. They also went and started their journey with SD-WAN so they could set it up correctly. So that led to them being able to execute for their customer. So if you've been there and you have a farm, you need propane. They have propane tanks outside. So instead of that customer coming inside, there's alerts that somebody needs to fill their propane tank, right? That wouldn't be possible with their old infrastructure, but they have now 5G inside and outside the store that alerts them. They can actually execute the payment on a mobile handheld device at the propane tank. They don't have to drag the customer back into the store to check out. So Tractor Supply also uses another device in the store, and all their associates now have 2 devices versus 7. They used to have a tool belt, literally, that they had a zebra scanner, they had a headset, they had many things that they carried in their tool belt to do their job. But once they introduced 5G, they went to 2 devices to execute, whether it was online orders, fulfillment. They could actually talk to the customer when they were out of, let's say, one type of chicken feed, and they could talk to them directly via this app on their phone to the customer and recommend something else and educate them why this is going to be okay for them, or when the next shipment was coming in. So they've evolved along the way due to 5G, because they had demands in their business. There was a worker shortage. There's tons of orders coming in. The speed which they had to deploy was a lot faster. So those are some things that real time with Tractor Supply that we've helped them along the way.
Awesome. All right. That concludes our session for today. Dr. Gall, thank you.
Thank you.
Roopi, thank you. Russ?
Yep,
Appreciate
the time.
Thank you guys for such a great session. I really found it interesting, especially the parts about how, telehealth is being able to do mobile CAT scans and bring a new level of healthcare to more rural areas, and also how the wearables are enabling people to be able to be in better control of their chronic diseases, as well as how in retail, how AI is reworking the distribution process, the customer service, customer journey. It's a really great insights, guys. All right. Well, that concludes our keynote session for today. I do have one housekeeping announcement. There is a tan Honda Civic